my job today is to talk about the importance of basic research in Wilson disease. And I know this is probably a relatively new talk for you, but I hope I convince you how much progress we have done with basic research. And the reason why I'm talking to you about this is that I'm a physician scientist. I take care of patients with Wilson disease, but I also do have a lab on Davis campus where we study mouse models of abnormal copper metabolism. So let's start from the beginning. What is basic science? So it's a broad terminology that means that we can study a mechanism of diseases in the lab using models, which include cellular models, which we study under the microscope, for example, and animal models, which include mice, rats, just to mention the small animal models, but there are some bigger models. And why is this important? So basic science has the goal to understand the fundamental principle of biology and nature. And basically, it explored the mechanism of a disease. And that is closely related to what we call translational science, where translational science take the discoveries from basic science and try to apply it to real world and to patients. So if basic science answered the question like, why does this happen? Translational science is how can we use this knowledge to help people and use the knowledge that is taken from basic science. So, and copper metabolism is very complex, and I know this audience is heterogeneous. There are students from campus, but just to show you that this is what happens to copper metabolism in patients. And as you can see, for example, the dietary copper is absorbed in the gut, which is represented here by this pink cylinder. And from the gut, copper goes through large veins, which is a portal vein in the liver. And copper there is processed, and from there it goes in the other organs outside the liver where copper is needed, because obviously we need copper. We don't want it in excess, but we need it. And so this process is basically not working, unfortunately, in patients with Wilson disease, but it's so complex. So in patients with Wilson disease, copper will accumulate in the liver, as you know, and will not have a way to go out either in the biliary tract, back in the gut, or in the systemic circulation. Will be eventually accumulating in the liver. And so this is so complex that we also have to have models to study this in the lab. And to add complexity, as you know, the gene that is mutated in patients with Wilson disease, it's up there. It's a representation, it's the ATP7B gene, which you have heard before today many times. And you can see here, this is a long gene that can have hundreds of mutations that can impair its function. And in the red squares there, you can see where two of the most frequent sites of the most frequent mutations are, but it can be in many places. And these genes is translated in the protein that you can see there, all these loops and that is responsible of the actual copper transporter. And all this complex machinery can be partially altered, very altered, or not functioning at all. So I hope you agree with me that we heard it before, the history of Wilson disease has been really fascinating, in the sense that it was discovered, and it's pretty recent, at the beginning of 1900, when Dr. Wilson first described the disease without knowing that it was about copper. And then there has been an acceleration, I think between the 80s, the 90s, and probably even more recently in the late 90s. And I do believe, I'm convinced that this acceleration in the knowledge and discoveries about Wilson disease is also due to the fact that we had great animal models replicating some of the main features of the disease. And you can see just here some of the example when they first cloned the gene. That was obviously a major finding, how to isolate the gene, they identified it. But then they found in the 90s this mouse model that had a similar mutation to humans and replicated copper accumulation in the liver, just like in humans. And from there on, a lot of medications were tested and confirmed and studied in these mouse models, including gene therapy. And like, for example, I'll give you some example of some major discoveries that were done in the lab, so through basic science. So for example, some cellular models of the ATP7B. So this is a study from Johns Hopkins, where you can see here in the two left upper corners, you can see that it's a dot. It seems like just a green, bright dot, but that it's an immunofluorescence that shows a normal ATP7B copper transporter, so it's bright, it's in the right position, and it's well represented. When they forced in this model other mutations that are seen in humans, for example, well, you can see that the dots in the other quadrants are just not like the same. They're not as bright as green, and they are in the wrong position. They have the wrong, like lower intensity, for example, and those represents basically copper transporters that, according to different mutations, were just not well represented or not represented at all. And that was one of the first demonstration that different mutation of the ATP7B causes different functional changes in the copper transporter. And that it possibly partly explain the variability in the disease manifestation. But I'll tell you more. So what about the animal models? This previous one was a cellular model. So we have mice that, for example, that's what we have here on Davis campus, that have a mutation with the ATP7B, so just like humans. They have a lifespan of about a year. Then there are rats, where these rats get really sick. They die within 3 to 4 months. And sometimes a model can also be a patient. We have dogs, for example, that have Wilson disease, in case you didn't know. And for example, Davis is a big veterinarian hospital. They follow a lot of Labrador Retriever with Wilson disease. Meet Glimmer. She's a real patient, not just a model. She's a patient with Wilson disease. But just to let you know, she's doing great because she's very adherent. She's taking penicillamine every day. And she's actually doing that. And so she's a lovely dog. Everybody loves her. So she's very famous around here. So with that said, for example, animal models allowed us to study available treatment. For example, we got zinc studies, which we all give it for granted. And, but it started with, George Brewer in Michigan studied patients, giving zinc to patients with Wilson disease, and they showed that it was effective in stabilizing copper metabolism with no neurological worsening, stable copper balance, and no liver copper excessive accumulation. But then that established treatment was followed by a lot of studies in rat model of zinc. I did some of those, for example, and we found out what was the mechanism of action of zinc, which blocks copper absorption in the intestine. So the animal models were instrumental to clarify this mechanism. But animal models are now fundamental to study new treatments. Like, for example, we are hearing about gene therapy. Well, the initial studies about gene therapy in Wilson disease were all done in mice. And these you have heard about, for example, the VIVET trials, which had great, the trial was unfortunately interrupted, but they had a very strong basic science. And where basically they showed that in the mouse model, the gene therapy was able to correct the disease. And what they did, for example, in this case, there was this construct where the ATP7B transgene was basically forced into the construct, which is like adenovirus derived, and this was injected in the in the mice. I think we have seen this slide before. And this was able to correct copper metabolism in the mouse. So like, as you can see here, there was the PET scan that Dr. Sandal was showing. They had these mice basically less copper accumulation, or basically no more copper accumulation in their liver. And this copper, instead of going in the liver, was going in the physiological direction through the stool, so where it's supposed to be eliminated from. This is all studied in mice. Before it was attempted in humans. In fact, they see here this graph that basically they corrected the liver numbers in mice got better, or actually were similar to the normal mice. They had no copper accumulation. These mice didn't die of the liver disease, and so it was very successful. We also are seeing a lot of studies that are coming out about the methanobactin, which is a new experimental drug that we haven't seen any human data yet. But the initial study, or not so initial anymore, frankly, because there's been several experiments, were just in rats, and where they showed that they rescue these rats from their mortality, and they had you can see those graphs where there is less and less copper. So basically, a dose-dependent reduction in the liver copper, and an increase of the copper in the stool, like it is supposed to be. So there are the rodent model, so mouse and a rat model, have a lot of advantages, basically. And to summarize, mice share more than 95% of their genetic material with the genes with humans, so there is a large overlap. So many human disease causing mutation can be recreated in mice, so we can study the mechanism of the disease. Now we have gene editing tools that can replicate actually even the same mutations in rodents. And yeah, I'm the host, so I'm going to take a little more time. And this is very interesting, so you got to. Researchers can, but also with animal models, we can tightly control the diet, the environment, and the genetic background to reduce the variability and the confounding factors that we can see in humans. And also we can collect several tissue, not just the liver, multiple organs, of course, all at the same time. And of course, we can overcome the limitations of having a small number of patients, because of course we can use more mice. And we can test new therapies before moving to clinical trials. We can do safety, dosing, and efficacy studies. We can demonstrate the mechanism of action of available medication or new medications, and reduce the cost compared to larger animals. In summary, rodent animals allow scientists to replicate several of Wilson disease clinical manifestations, study disease progression in detail, and test therapies that are in a cost-effective and ethically feasible way before moving to clinical trials. But they do have limitations that I will mention, is that rodent, so mice and rats and dogs, do not present the neurological manifestations. And the liver disease is not exactly the same as the humans. So like, for example, the mice or rats present some tumors that we don't see in humans. So they don't have the whole clinical presentation. The copper metabolism is similar, not quite the same, without going in details. Of course, animals cannot replicate human diversity. And there is a big lifespan mismatch, of course. You've seen that the mouse will usually die within a year. And then, of course, the lifespan of a human, obviously, it's much longer. And of course, there is also ethical consideration. I've sounded a little casual about using a lot of mice, but the reality is that they are living creatures, and we don't want to use any time more than what is necessary. So they're tightly regulated, but very specific, tight protocols. With that said, basic research has made enormous progress in Wilson disease, and also although there are some challenges and limitations, basic research has allowed us to better establish, to better study established treatments and new treatment or possible cures. And thank you for your attention.